Continued census data showing that the state of Illinois loses people. And the latest data is about cities and municipalities across the country in migration trends. Good morning, Springfield's Morning News. I'm Greg Bishop on 92.7 WMAY, Springfield's News and Talk. We've talked a lot about population decline in Illinois, especially when it comes to officials like Governor J.B. Pritzker denying that the state's losing population. This all started probably 8 or 9 years ago with annual estimates coming out showing that the state of Illinois continues to lose population. At first, it was like 10,000 people one year, and then the next year it was about 30,000 people fewer, and then the next year it just kept accelerating to where the most recent annual estimates showed more than 100,000 people have left Illinois. Now, those are the annual estimates from the U.S. Census. The decennial census, the 10-year census that's used to, apportion members of Congress, that came out, a while back for the year 2020, and it showed that Illinois lost 18,000 people. That was enough people for Illinois to lose a seat in Congress and therefore lose a little bit of influence in the U.S. Congress. So Illinois continues to lose population according to every metric, and it's not just the U.S. Census data. You've also got IRS data that recently came out showing migration from one state to the next, and it showed that states like Florida, they gained a bunch of people, a bunch of taxpayers, and even saw an increase of like $50 billion in tax revenue from those who moved to Florida. On the other side of the spectrum, Illinois lost about $10 billion in taxpayer resources because people were moving out of Illinois. Now, we've reviewed Governor J.B. Pritzker's reaction to these stories and others, and he just denies it. He says that those are all estimates and Illinois is actually growing. Well, we may be growing when it comes to undocumented migrants being transported to Illinois from the southern border, and we may see a lot more of that. We'll touch on how much that's costing taxpayers, but let's get into this Illinois policy report based off of U.S. Census data showing 85% of Illinois communities lose people in 2022. Chicago loses 33,000. So of 1,100 Illinois communities of all sizes, they share in a record of 104,000 residents in 2022 leaving the state. Chicago lost 32% of the state's total. So they break down all of this data from the U.S. Census Bureau. 85% of Illinois communities lost population in 2022. You've got the biggest Illinois cities were the biggest losers, and also the largest Illinois cities lose residents at a faster rate in 2022. It goes on to talk about Chicago in particular, how it had the second largest population decline in the U.S., behind only New York, which, holy cow, New York lost 123,000 people. Chicago losing about 33,000. Then you got Philadelphia, Los Angeles, San Jose. What's a common theme here? These seem to be cities that are run by Democrats. You continue on with the Illinois policy report here, and it talks about the individual cities where there were large amounts of people leaving the state. And you've got Danville leading behind Chicago, of course, with at least the rate. They've got this as far as the overall change in the rate. But Springfield's on that list as well with a change of 951. Rockford, a change of around 1,400. The St. Louis metro area down almost 11,200. And other places seeing some growth, like Elgin, 65 people gained. Hey, look at that. So this obviously is a huge issue that deals with policies that have been put in place by legislators that Republicans have been decrying for years, saying, hey, you're not making it easy to do business in Illinois. You're making it too expensive with workers' comp costs, high property taxes, continued sales taxes, and how all that impacts the business climate. If you don't have good jobs, you're not going to have people wanting to get those good jobs in the state of Illinois. They'll just go across the border where these places are setting up shop. You also have the overall question of education, with continued challenges of Illinois schools not serving students the best that they can. And these are all things coming to a head as Illinois, in the latest data, shows that we're losing population, not just from the census, not just from the IRS, but also data from moving companies like U-Haul and United Van Lines. They show that Illinois is a regular leader in annual estimates of people leaving the state based off of their data, the private moving companies' data. So we'll hear from, coming up, a news conference yesterday dealing with a different migration set, and that's the cost of individuals coming into Illinois undocumented, and advocates saying that Illinois taxpayers need to further subsidize the health care of undocumented migrants, not just those who are over the age of 42, which Illinois policy already does. Fund subsidized healthcare coverage for those over the age of 42 in this country, undocumented, living in Illinois. They want to lower that age down to 19, and you can consider the added costs when it's already estimated the current program is going to cost about $1 billion. So stay tuned. We'll get to that coming up next here on WMAY. It is Springfield's Morning News. I'm Greg Bishop. Stay tuned. We've been talking about Illinois' continued population decline. According to U.S. Census data, Chicago led the nation as number 2, only behind New York in losing people out of the Windy City. But 83% of Illinois' communities saw a population decline in the most recent data of municipal migration from the U.S. Census. What about those who are coming into the state? Undocumented migrants, maybe they're seeking asylum. They cross the southern border, and communities in Texas sending them to all kinds of places, including Chicago. Well, Illinois has already have a policy on place that allows for fully subsidized health care coverage for migrants above the age of 42. And the estimates are it's going to cost $1 billion in the next fiscal year that starts July 1st. Well, there were advocates at the statehouse yesterday pushing for even more subsidies for those who are here undocumented. And here's a little bit of that news conference yesterday.
My name is Tovia Siegel. I'm the director of the Healthy Illinois campaign, and we are here today to demand health coverage for everybody in Illinois, regardless of their immigration status. So in just a few days, the Illinois General Assembly, right upstairs, is going to decide whether they fund health care for 116,000 additional people. Budget negotiations are happening right now, and there's been a lot of focus, as you all know, on immigrant health coverage. But what we're hearing, when we hear politicians say that there's not enough money for extending coverage this year, we're hearing that they're okay with leaving 100,000 people behind. We're hearing that they're okay with leaving 100,000 people to get sick, to not be able to access the care that they need, the care that we all deserve, and that's something, a compromise they're willing to make.
So she continues to talk about increasing the subsidies for more people, saying it's only going to cost about $200,000 or $200 million more.
That $200 million is 0.4% of the state budget. We are talking about 0.4% of the budget. And it saves lives in the long run. It saves lives and it saves money too. This isn't breaking the state budget. And to say so is just blatantly anti-immigrant when we're talking about 0.4% of the state budget.
So, again, the budget's going to be coming together. We haven't seen the details. They're going to expand the subsidies for individuals who are here undocumented. Right now, it's at 42 and above. Some people want to bring it down to 19 years old. Here's Theresa Ma, a Democrat out of Chicago.
Immigrants are part of our community, and we need to ensure that everyone has access to health care, especially preventative care, so that the costs down the road do not expand and become prohibitive. So, for the members of my community that would truly benefit from this expansion and who have benefited from the expansion of 42 and above, I think it's really important to maintain the healthcare services that we have made available, but also strongly consider and include in the budget as much as we can to expand healthcare access to as many people as possible.
So again, that's Theresa Ma talking about wanting to expand subsidized healthcare for undocumented migrants in Illinois, after Illinois continues to lose population year after year after year after year. A lot more coming up. Stay tuned. It's WMAY.